Pharmacists prepare and dispense medications, ensure prescriptions are safe and appropriate, and provide advice on proper medication use. They also educate patients on side effects, drug interactions, and general health and wellness. In today's video, we explore 26 pharmacist interview questions and answers. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, be sure to research the company and review the job description so you can include key skills relevant to the job role in your answers. Let's explore some common general pharmacist interview questions. Question number 1. What subject did you enjoy the most in school? Which did you find the most challenging? Hiring managers ask this to understand your academic interests and how you approach difficult material. They're looking for passion in the subject matter that directly relates to pharmacy, as well as resilience when faced with challenges. Your answer gives them insight into your work ethic, self-awareness, and learning style. All important qualities in a pharmacist. They also want to know how you build on your strengths and improve in areas that don't come as easily. I enjoyed pharmacology the most. It helped me connect classroom knowledge to real-life patient care, especially understanding how medications affect the body and interact with each other. I liked analyzing case studies and applying that knowledge to make informed decisions. It made me feel confident that I was preparing for a career with direct patient impact. The most challenging subject was biostatistics. At first, I struggled with interpreting data sets and understanding statistical models. However, I knew that mastering it was key to evaluating research and making evidence-based decisions. I started attending study groups, asking more questions in class, and using real-world clinical articles to see how statistics are applied in context. That challenge taught me that persistence and adjusting your study strategy can turn a weakness into something manageable. It also reminded me that in pharmacy, being open to growth and asking for help when needed are essential parts of staying sharp and safe. Question number 2. Why did you choose pharmacy as a career path? This question helps hiring managers understand your core motivations. They want to hear a story or experience that led you to pharmacy and be sure you're not choosing it just for job security or pay. Passion, empathy, and a strong understanding of the pharmacist's role all signal you'll stay committed to the profession and handle the responsibility well. I chose pharmacy because it combines science with real human connection. In high school, my grandfather had several medications, and I often helped him organize them. One day, his pharmacist noticed a potential interaction and quickly worked with the doctor to change the prescription. That moment stuck with me. It showed me how pharmacists protect patients in ways people don't always see. As I got deeper into school, I realized how much I enjoyed learning about pharmacokinetics and patient counseling. I loved the idea that I could use both clinical knowledge and communication skills to help people manage their health. Pharmacy appealed to me because of its evolving role. Whether it's managing chronic diseases, offering vaccines, or answering questions on over-the-counter medications, pharmacists play a key role in frontline care. I wanted to be part of that, someone patients could trust and turn to when they're unsure or overwhelmed. That sense of responsibility is what drew me in and keeps me motivated. Question number 3. What are your strengths and weaknesses? Hiring managers ask this to gauge your self-awareness and emotional intelligence. They want to know if you understand your role in a team, how you leverage your strengths in a clinical setting, and how proactive you are about improving your weaknesses. The key is showing you're reflective and always working to grow, especially in areas that impact patient care or workflow. One of my strengths is communication. I'm confident speaking with both patients and healthcare professionals, and I take time to ensure patients leave the pharmacy with a clear understanding of their medications. During clinical rotations, I was often asked to counsel on new prescriptions because I made people feel at ease, especially those managing multiple medications or new diagnoses. I've found that strong communication not only builds trust, but also improves adherence and safety. A weakness I've worked on is time management in high-pressure settings. In the early part of my internship, I would sometimes get caught up in one task and fall behind during busy hours. I realized that I needed a better system for tracking what needed to be done and when. I started using a priority list during each shift and regularly paused to reassess what was most urgent. That helped me stay organized and meet demands more efficiently. I've made real progress, and it's something I continue to improve. Question number 4. Where do you see yourself in 5 years? This question is meant to assess your long-term vision and how committed you are to the pharmacy field. Employers want to know if you plan to grow with them, take on more responsibility, or explore areas like clinical services, leadership, or specialization. It also gives them a sense of how ambitious and self-directed you are. In 5 years, I see myself growing into a leadership role within a pharmacy team. I'd like to be someone who newer pharmacists and technicians look to for guidance, whether it's in daily operations or patient counseling. I'm interested in becoming a preceptor and helping pharmacy students or interns transition into the field confidently. I also want to continue expanding my clinical knowledge, especially in chronic disease management. I believe pharmacists will take on even more patient-facing roles, and I'd like to be at the forefront of that. I plan to pursue continuing education and stay current with changes in treatment guidelines and new therapies. More immediately, I hope to contribute meaningfully to a pharmacy team, build strong relationships with patients, and gain deeper experience managing medication therapy. Whether I'm supporting operations, training others, or helping patients feel confident about their treatment, I want to be a reliable and valued part of a pharmacy that puts care first. Question number 5. What can you offer us that someone else can't? Hiring managers want to know what sets you apart. This isn't just about technical skill, it's about personality, mindset, or a unique perspective you bring to the team. They're listening for someone who brings real value and can handle challenges in a way that others may not. What I can offer is a combination of clinical knowledge, communication skills, and a deep sense of accountability. I care about the details and the people behind them. Whether I'm verifying a prescription, counseling a patient, or supporting a technician, I approach every task with a strong sense of ownership. During my clinical rotations, I received feedback that I was dependable under pressure and often the first to step up when something needed attention, whether it was checking a high-alert medication or staying late to ensure patients had their prescriptions on time. I don't see pharmacy as just a process. I see it as a trust-based service. I also bring a calm, level-headed approach that helps keep things moving smoothly even on busy days. That kind of attitude can have a positive effect on team morale and patient experience. You'll get someone who's not only trained but invested in doing the job well every single day. Question number 6. How do you prioritize your tasks in a busy environment? This question evaluates how you handle pressure, multitasking, and time management. Key skills in a pharmacy setting. Hiring managers need to know that you can stay calm, organized, and focused on safety when things get hectic. When it gets busy, I rely on a mix of structured prioritization and constant reassessment. I start by identifying tasks that impact patient safety or waiting times, verifying prescriptions, addressing urgent patient concerns, and checking time-sensitive medications always come first. I also communicate clearly with technicians, so we're aligned on who's doing what. If new tasks come in, I quickly assess their urgency compared to what I'm already handling. I've found it's better to pause for 30 seconds and plan than to rush and make mistakes. For example, during one particularly busy shift, I divided tasks into 3 categories: urgent, high priority, and routine. That made it easier to keep everything moving without letting anything slip. Clear communication is also key. If I'm backed up, I'll let my team know and work together to adjust. My goal is always to stay focused, flexible, and aware of what matters most at any given moment. Question number 7. Why do you want to work for our pharmacy? They want to see if you've done your research and whether your goals and values align with the company's culture. Employers also want to know that you're not just looking for any job, you're interested in their pharmacy for a specific reason. I want to work for your pharmacy because of the reputation you've built for both patient care and employee development. I've read reviews from patients who mention feeling truly listened to by your team, which really stood out to me. That's the kind of environment I want to be part of, where counseling and care aren't rushed but meaningful. I'm also impressed by your focus on clinical services like immunizations and medication therapy management. Those are areas I'm passionate about and want to keep growing in. It shows me that you view pharmacists as more than dispensers. You see us as healthcare providers. I've also heard from a colleague who interned here that the team is collaborative and the workflow is well managed. That kind of supportive culture is important to me. I believe I could bring value through my patient-centered mindset and strong work ethic while continuing to learn and contribute to the growth of your pharmacy. Question number 8. What are your biggest accomplishments and why are those a big deal for you? Hiring managers ask this to understand what you value, what you consider meaningful success, and how you measure impact. They're looking for a sense of pride, initiative, and alignment with the responsibilities of a pharmacist. This question also helps them evaluate how your past achievements could translate into future performance. One of my proudest accomplishments was creating a medication reconciliation workflow during my clinical rotation at a hospital. We noticed frequent discrepancies in patients' medication histories during admissions, which could delay treatment and create risk. I took the initiative to collaborate with the nursing staff and pharmacy preceptors to develop a step-by-step intake checklist and provided quick reference guides for students and new staff. Within 2 months, we saw a noticeable drop in medication errors and faster verification times. This mattered to me because it wasn't just a process improvement, it directly impacted patient safety. It also helped me build stronger communication skills by working across departments and learning how to present ideas clearly and respectfully. Seeing something I helped design make a tangible difference in care reinforced why I chose this profession. I realized that even small changes, when implemented well, can improve both workflow and outcomes. That experience taught me how pharmacists can be proactive problem solvers, not just dispensers of medication. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 9. Describe a situation where you went above and beyond what was expected. This question helps assess your work ethic, initiative, and how much ownership you take in your role. Hiring managers want to know if you're the type of person who will do what's necessary or someone who strives to do more when it benefits patients, colleagues, or outcomes. During a community pharmacy rotation, I noticed a regular patient had been filling several prescriptions from multiple providers, some of which had potential interactions. While it wasn't part of my assigned duties, I took the extra time to review her entire profile and flagged the issue to the supervising pharmacist. I then called the patient and, with her consent, coordinated with her primary care physician to consolidate her medications into a safer, more manageable regimen. This went beyond what was expected of a student, but it was important to me that she receive safe and cohesive care. Afterward, the patient expressed relief and gratitude, and the pharmacist praised the extra effort. That moment showed me how pharmacists are often the last line of defense in preventing harm. I learned that small decisions, like taking a few more minutes to investigate something, can protect patients in major ways. It confirmed that I want to work in a setting where patient well-being is the top priority. Question number 10. Tell me about a leadership experience you have had. Hiring managers want to see how you lead others, even in informal roles. They're not always looking for someone with a formal title. They're looking for someone who can influence, support, and guide others in a clinical or professional setting. This reveals your communication skills, responsibility, and ability to build trust. During my final year of pharmacy school, I was selected to lead a group research project on medication adherence among elderly patients. My team included students with different strengths and communication styles, and early on, it was clear we needed structure. I created a shared task board, set weekly check-ins, and helped delegate responsibilities based on each person's interests. One teammate was struggling with data analysis, so I worked with them one-on-one outside of group time until they felt more confident. We completed the project on time and were invited to present at a regional pharmacy conference. This experience mattered because it taught me that leadership is more about support than authority. I wasn't just assigning tasks, I was helping the team succeed together. That's something I carry into clinical settings too, encouraging collaboration, listening actively, and stepping up when someone needs guidance. Leadership as a pharmacist means being accountable and helping others do their best, especially when patient care is on the line. Question number 11. Tell me about a time you disagreed with a colleague. This question gives insight into your communication style, emotional maturity, and problem-solving ability. Pharmacists often collaborate with physicians, technicians, and other healthcare providers. Hiring managers want to know you can express concerns respectfully, listen to others, and resolve disagreements without escalating tension. During one of my clinical rotations, I noticed a technician preparing a pediatric antibiotic suspension using the wrong concentration. I respectfully pointed it out, but the technician insisted the prescription was accurate. Instead of arguing, I reviewed the chart again, double-checked with the guidelines, and then brought it to the pharmacist's attention privately. We discovered it was indeed a misinterpretation of the dosing instructions from the physician. After clarifying the prescription, the technician thanked me for catching it, and we avoided a potentially serious dosing error. This situation reminded me that disagreement doesn't need to be personal. It's about focusing on the shared goal of patient safety. I've learned to approach these situations calmly, with facts and empathy, because working in healthcare means trusting each other and always being willing to speak up when something doesn't look right. Clear communication and mutual respect are essential when making clinical decisions as a team. Question number 12. What would you like to accomplish in the first month, 60 days, or 90 days on the job? Hiring managers want to know if you've thought about how you'll integrate into the team and how quickly you can begin contributing. This question shows how you approach learning, building relationships, and setting goals. They're looking for someone proactive, thoughtful, and committed to long-term success. In the first 30 days, my focus would be on learning your systems, policies, and patient workflow. I'd shadow team members, review protocols, and build strong communication with the pharmacy team, prescribers, and techs. I want to be confident in the tools and expectations before stepping into full responsibilities. By 60 days, I'd aim to handle most dispensing and counseling responsibilities independently, while identifying any areas where I can support efficiency, such as improving medication access or helping with MTM follow-ups. I'd also seek feedback to make sure I'm aligned with expectations and contributing positively to the team dynamic. By 90 days, I'd like to be fully integrated, contributing not just clinically, but also helping precept students, supporting process improvements, or identifying patient outreach opportunities. I believe the first 90 days set the tone, and my goal would be to show I'm reliable, resourceful, and here to improve both patient care and team collaboration. Question number 13. What do you like about working with patients? This question helps hiring managers understand your bedside manner, empathy, and communication style. They want to see that you enjoy helping people, not just processing prescriptions. Your answer gives insight into how you build trust, educate patients, and contribute to better health outcomes. What I enjoy most about working with patients is the opportunity to be a trusted resource in moments when they might feel overwhelmed or unsure. Whether it's explaining side effects in simple terms or helping someone manage a complex medication regimen, I find it meaningful to offer clarity and reassurance. I've seen firsthand how a pharmacist can make someone feel heard just by taking a few minutes to listen and answer questions with care. That connection can make all the difference in whether a patient sticks to their therapy plan. I also enjoy educating patients, especially those managing chronic conditions, because helping them understand their medications empowers them to take better control of their health. Whether in a community setting or clinical environment, I see patient interactions as a chance to build trust and support long-term wellness. It's that personal impact that makes this profession rewarding for me every single day. Here are some common pharmacist interview questions based on your background and experience. Question number 14. Describe a problematic situation that occurred in a pharmacy and how you handled it. Hiring managers want to see your ability to think critically, act responsibly, and maintain patient safety under pressure. They're also assessing how well you communicate with your team and how you resolve issues without escalating conflict. Your answer gives insight into your judgment, accountability, and professionalism. During one shift, a patient came in to pick up a prescription that had a dosing discrepancy between what the doctor wrote and what the patient expected. The physician had prescribed 10 milligrams, but the patient was certain they had always taken 5 milligrams. I double-checked the profile, and it showed 5 milligrams for the past 6 months. Rather than making assumptions, I paused the fill and called the prescriber to clarify. It turned out the doctor had intended to increase the dose but hadn't communicated that to the patient. I updated the prescription notes after confirming, educated the patient about the reason for the change, and advised them to contact their provider if they had any concerns. The patient appreciated being informed, and the situation was resolved without confusion or mistrust. It reminded me how important it is to be both thorough and patient-focused, especially when small errors can have serious consequences. Question number 15. How do you keep your knowledge up to date with current pharmacy trends and new drugs? Pharmacy is constantly evolving, and hiring managers want to know if you're proactive about continuous learning. This question helps them gauge how you stay clinically competent and aware of emerging treatments, regulations, or guidelines. To stay current, I set aside time each week to read industry publications like Pharmacy Times and American Journal of Health System Pharmacy. I also subscribe to newsletters from the FDA and CDC, which keep me informed about recalls, approvals, and immunization updates. I've found continuing education courses not only valuable for license renewal, but also for digging deeper into new therapies or disease states I don't see every day. I often choose CE courses related to patient safety, chronic disease management, or new pharmacologic classes. I also attend webinars and local pharmacy association meetings to hear real-time case discussions and policy updates. In the pharmacy, I regularly share what I've learned with colleagues and ask them what they're seeing in practice. This creates a culture of learning and collaboration. Staying current helps me make better clinical decisions, offer patients the most relevant information, and remain confident in the care I provide. Question number 16. Describe your experience with performing immunizations for patients. Hiring managers want to confirm that you're trained and confident in administering vaccines, an essential service in community and clinical pharmacy. They're also looking for your communication skills, your ability to ease patient concerns, and how well you follow protocols. During my pharmacy rotations and in my most recent position, I've regularly administered vaccines, including flu, shingles, pneumonia, and COVID-19. I completed my immunization certification early and felt confident with both the technical and patient-facing aspects. What I've learned is that giving the shot is only half the job. Educating and reassuring patients matters just as much. One example that stands out was a patient who was extremely nervous about the COVID booster. I took a few minutes to explain the common side effects, the benefit-risk balance, and what to expect after the injection. Once they felt heard and informed, they agreed to move forward. I always follow protocol, double-checking consent forms, confirming patient identity, and documenting everything properly. I see immunizations as an opportunity to improve public health and strengthen trust with the community. I enjoy being part of that direct patient impact. Question number 17. How do you educate patients in managing their medication? This question evaluates your ability to communicate clearly and empower patients to manage their health. Hiring managers want to see that you can adapt your explanation based on a patient's background, health literacy, and specific needs. I always start by assessing what the patient already knows. I ask open-ended questions like, can you tell me how you've been taking this medication? Or what concerns do you have about it? This gives me a baseline to work from and shows patients that their input matters. From there, I break things down using plain language, avoiding medical jargon. I focus on 3 key areas: what the medication is for, how and when to take it, and what side effects to watch for. For patients managing multiple prescriptions, I sometimes create a simplified schedule or recommend using a pill organizer. If English isn't their first language or they seem overwhelmed, I'll offer printed materials, visuals, or even involve a caregiver if appropriate. Before they leave, I always do a quick teach back. Can you repeat how you'll take this at home? It's important to me that they leave feeling confident, not confused. Question number 18. What challenges do you encounter on a daily basis? This question reveals your awareness of real-world pressures in pharmacy and how you manage them. Hiring managers are interested in your problem-solving skills, resilience, and ability to prioritize patient care despite constraints. A common challenge is managing high prescription volume while still giving each patient the attention they deserve. It's easy for a pharmacy to get overwhelmed, but I've learned to stay focused and organized. I triage tasks based on clinical urgency, use workflow tools effectively, and communicate clearly with my team. Another challenge is dealing with insurance or prior authorization issues. When medications are delayed due to coverage, patients understandably get frustrated. I always take the time to explain their options, contact the prescriber when needed, and suggest alternatives when appropriate. Misinformation is also something I encounter frequently, whether it's about vaccine safety or how a drug works. I take those moments as teaching opportunities rather than arguments. Being calm, respectful, and well-informed helps patients feel safe and supported. No day is completely smooth, but I view challenges as chances to improve systems, build trust, and ensure every patient gets safe, effective care. Question number 19. Describe a time you simplified complex medical treatment information for a patient. Pharmacists often need to explain difficult concepts in simple terms. This question helps hiring managers understand how well you connect with patients and how you adapt your explanations to ensure medication adherence and safety. A patient once came in with a new prescription for warfarin and was overwhelmed by the list of food interactions, dosing changes, and monitoring requirements. They had just been discharged from the hospital and looked confused and anxious. I sat them down in a quiet space and started by saying, "Let's focus on what's most important for today." I explained what warfarin does and why it was prescribed. Then I used a printed chart with foods high in vitamin K and highlighted a few examples. I emphasized consistency, not restriction, so they didn't feel overwhelmed. I also explained the purpose of INR testing in simple terms. Think of it as a blood test to make sure your medication is working safely. Before they left, I gave them a printed summary and offered to speak with a family member if they had more questions. The patient thanked me for making it feel less scary. Moments like that remind me how education can reduce fear and build trust. And finally, here are some common advanced and behavioral pharmacist interview questions. Question number 20. Give me an example of a time you didn't meet a patient's expectations. What happened and how did you resolve the conflict? Pharmacists interact with patients who may be anxious, frustrated, or confused. Hiring managers ask this to understand how you respond to feedback, manage conflict, and maintain professionalism. They want to see if you take responsibility and can turn a negative experience into a productive one. The way you handle dissatisfaction says a lot about your communication style and commitment to service. A patient once came in to pick up a prescription that wasn't ready due to an insurance prior authorization delay. She was upset, saying no one had contacted her. I understood her frustration and apologized for the lack of communication. I calmly explained the insurance process and what steps we were taking. To resolve the issue, I immediately called the physician's office to help expedite the prior authorization and followed up with the insurance company. I also kept the patient updated with each step so she felt informed and reassured. The prescription was approved that same day, and she thanked me for being so proactive. That experience reminded me how important clear communication and follow-through are, especially when expectations aren't met. I now always double-check that patients are aware of any delays and make a point to explain the why behind them. Question number 21. When you're working with a larger number of patients, it's challenging to provide excellent service to everyone. How would you prioritize their needs? Pharmacists must often balance accuracy, speed, and patient care under pressure. Hiring managers ask this to evaluate how you triage tasks while maintaining safety and professionalism. They want to know if you can think critically and prioritize without sacrificing quality. Your response shows how you operate under stress and stay organized in a high-demand environment. In a high-volume setting, I first assess urgency and clinical significance. For example, if someone is waiting for antibiotics for an active infection or a time-sensitive pain medication, I'll prioritize that over a routine refill. I also consider whether a patient is physically waiting in the store, which can impact the experience and flow. At the same time, I lean on teamwork. I communicate with technicians to divide responsibilities and make sure everyone knows the priorities. I keep a running mental or written list of the most urgent orders and continuously update it as new prescriptions come in. If a delay is unavoidable, I'm transparent with the patient and offer options, such as partial fills or estimated wait times, so they feel respected and informed. By staying flexible, focused, and communicative, I can keep service levels high even during busy shifts. Question number 22. Can you describe a time you handled a difficult patient? Pharmacists work directly with patients who may be in pain, upset, or confused. Hiring managers ask this to assess your ability to stay calm, communicate clearly, and de-escalate emotionally charged situations. They want to know that you can maintain professionalism while showing empathy. Your answer shows whether you can find solutions under pressure and protect the patient relationship. A patient came in very upset because her insurance didn't cover her brand name medication and she didn't want the generic version. She raised her voice and accused us of changing her prescription. I stayed calm, listened closely, and reassured her that we hadn't made any changes without her doctor's approval. I explained that her provider had authorized a generic equivalent due to cost and coverage. I offered to call the prescriber with her present so she could feel confident in the explanation. After the call, she felt much more at ease and agreed to try the generic. Afterward, she returned to thank us for taking the time to explain everything. That experience reminded me that many difficult interactions stem from fear or confusion. Clear, respectful communication can make all the difference. Question number 23. Tell me about a time when you had an overwhelming number of responsibilities. What did you do? Pharmacists juggle multiple priorities: prescriptions, patient counseling, insurance issues, and team coordination. Hiring managers ask this to see how you manage pressure without compromising safety or service. They want to know if you can think critically, delegate, and stay organized when things get hectic. Your response reflects your leadership and time management skills. During flu season, our pharmacy was short-staffed while managing a rush of prescriptions, vaccines, and walk-in patients. At one point, the line was out the door, phones were ringing nonstop, and I had 5 vaccines scheduled within 30 minutes. I paused, took a breath, and prioritized safety and efficiency. I asked a technician to focus solely on answering phones and another to prep all vaccines while I handled urgent prescriptions. I grouped similar tasks together to minimize time spent switching gears, and I communicated with waiting patients about estimated wait times. Most were understanding once they saw we were being transparent. By staying calm and trusting the team, we worked through the backlog without compromising care. That day reinforced how critical it is to stay composed, communicate clearly, and lean on delegation when the volume spikes. Question number 24. Describe a time you had to use fact-finding skills to solve a problem. Pharmacists often need to investigate prescription discrepancies, drug interactions, or incomplete patient information. Hiring managers ask this to assess your attention to detail and critical thinking. They want to know that you don't make assumptions and that you know how to gather accurate information to make safe decisions. Your answer shows how you troubleshoot. A prescription came in for a pediatric patient with a dose of amoxicillin that seemed too high for the child's age and weight. I double-checked the prescription, but it matched what the doctor had written. Instead of assuming it was correct, I called the prescriber to verify. It turned out there had been a mix-up with the child's weight. They had entered pounds instead of kilograms into their system, which led to a much higher dose. We corrected it immediately, and the physician thanked me for catching it. That situation highlighted how important it is to stay alert, even with routine medications. I never assume something is safe just because it's familiar. I always verify dosing, indications, and patient specifics before dispensing. Question number 25. What would you consider to be a clinically significant interaction between drugs. Pharmacists are medication experts, and identifying drug interactions is a core responsibility. Hiring managers ask this to test your clinical knowledge and judgment. They want to see that you can recognize high-risk situations and explain them clearly. It also shows whether you understand how to intervene when necessary. One clinically significant interaction that comes to mind is between warfarin and trimethoprim sulfamethoxazole. The antibiotic can significantly increase INR levels, raising the risk of bleeding. I once had a patient on long-term warfarin therapy who was prescribed Bactrim for a urinary tract infection. Before dispensing it, I contacted the provider to discuss the risk. We decided to reduce the warfarin dose and scheduled an INR check within 48 hours. I documented the conversation and counseled the patient to watch for any signs of bleeding. The follow-up INR was elevated but within range, and we adjusted the dosing again. This type of interaction can have serious consequences, so it's critical to catch it early and work collaboratively with the care team. Communication and follow-up made the difference in this case. And finally, here's the last question. Question number 26. How would you grade yourself? When it comes to identifying drug-seeking behavior in patients, have you encountered this problem and how have you handled it? Hiring managers ask this to see how well you recognize signs of controlled substance misuse and how you respond ethically. They want to ensure you're confident yet cautious and that you know how to handle delicate situations without making accusations. It's a test of judgment, communication, and integrity. I would give myself an 8 out of 10. I stay vigilant when it comes to controlled substances and have had training in recognizing red flags like early refill requests, prescriptions from multiple providers, or inconsistent stories. One instance involved a patient asking for a high-dose opioid early, claiming it was stolen. I checked the prescription monitoring program and saw similar patterns from different pharmacies. I calmly explained that I couldn't fill the medication early without proper documentation and advised the patient to speak with their provider. I also documented the interaction and alerted the pharmacy manager. The goal is always to be professional and respectful, while also protecting the patient and community. In situations like this, I try to balance empathy with accountability. We're not here to judge, but we are here to make sure medication is used safely and appropriately. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.